respectful of everyone during the comment period. We have a lot of people present tonight, and we want to give everyone who has signed up the opportunity to speak within the published time frame. That time frame will start when we begin the first speaker. Your time will be limited to 3 minutes. This is your time and cannot be used by anyone else. At the end of your 3 minutes, we will go on to the next presenter. Please speak directly to the chair of the board and not address any specific board members. If you wish to speak, please offer new information and do not repeat the same information from a previous speaker. The board is here to listen to your comments, and the board will take your comments under advisement when making decisions. Right. Thank you. The first person that we have on the agenda to speak is Kevin Manning from Liberty. Elsie, is Kevin Manning there?
I'm not seeing Kevin listed. Kevin, if you are on, please raise your hand so that I can unmute you.
Good evening. Can you hear me?
Yes. Yes. Are you Kevin Manning?
I am Kevin Manning.
Okay. When you begin, we start our hour. So go ahead.
All right. Thank you for having me this evening. I'm happy to speak about the proposed learning guidance. A mask mandate for schools is unnecessary, divisive, and damaging for our students, teachers, and the fabric of our community. Irrational fear is creating a cure that's worse than the disease, and the Clay County Board of Health should reject any mask mandate as part of the proposed learning guidance. The case against mask mandates for schools is straightforward. First, children under the age of 19 are at little to no risk for serious illness or death from COVID. Clay County doesn't have COVID data broken down by age group on the dashboard, but Johnson County does, and I'll be sharing excerpts from that data tonight. Since the beginning of the pandemic in March 2020, there have been 10,000 minors in Johnson County test positive for COVID. There have been 0 cases where a minor needed a ventilator or died from COVID in Johnson County. 0 deaths in 18 months out of a county with 600,000 people. According to the CDC variant tracking website, the Johnson County data I just referenced includes 7 weeks where the Delta variant was the predominant strain in Missouri and Kansas. The Delta variant may or may not be more contagious, but it is not shown to cause severe illness in children over the past 7 weeks. National COVID data shows that among children, the death rate for COVID is slightly less than seasonal influenza. 2 years ago, if anyone had come before this Board of Health advocating for universal masking due to the flu, they would have been dismissed as completely irrational. Yet now, with the virus less impactful to children than the flu, we're contemplating masking all school children for the 2nd straight year. That too is irrational. The current data shows that COVID and all of its variants is not a serious risk to the health to the vast majority of children. Second, a common argument for masks last year was that while children may not be significantly impacted by COVID, they could still be carriers to high-risk populations, including teachers or other school district staff. The vaccine has been readily available to high-risk residents for over 6 months. If you believe the vaccine is effective at mitigating COVID symptoms, as I'm sure this health board does, you have to conclude unvaccinated and unmasked children pose little threat to vaccinated adults. If COVID does not pose a serious risk to children, vaccinated adults, what is the rationale behind requiring mask mandates? I suppose the answer could be unvaccinated adults. Some adults may choose not to receive the vaccine. This could lead to negative consequences depending on their age and personal health, but ultimately that is their prerogative. Children should not have to endure punitive masking and other measures due to the choices of adults, nor should children be used as a lever in an attempt to force the adult population towards a higher vaccination rate. Finally, and probably most frustratingly, there is no long-term problem that masking solves. COVID is not smallpox or polio and will not be eradicated in the near future, even with increased vaccination rates. It's overwhelmingly likely that COVID will become endemic with infection rates that wax and wane similar to the flu and common cold. If mask mandates are justified now, they will be justified in perpetuity, and we will be having this exact same conversation next year and the year after. There is no finish line at which masks will be required because COVID cases will continue, new variants will emerge, and there will always be a new emergency. I'd like to encourage everyone listening tonight to continue to engage with local and state elected officials if you'd like to see the future of mask mandates change. If you're interested in serving as an elected official, now is the time to run. Thank you for the opportunity to speak tonight, and I urge the board to reject mask mandates for the upcoming school year.
Thank you, Mr. Manning. Our next speaker is Deborah Collin from Kansas City.
Hello, let me turn my video on. Good evening.
Hello.
Yes, hello, can you hear me?
Yes, go ahead.
Okay, thank you. Thank you all for giving this opportunity to speak. Thank you for allowing the public to give public comments. I am going to use my time to share a statement from Dr. Lori Boffman, who's been a primary care doctor in our community for over 20 years. She's an internist and a pediatrician, so she sees adults and kids in clinic and in the hospital.
Ms. Collin, Ms.
yeah.
Collin, this time is for you. This needs to be what you want to present.
Yes, this is what I
your
would.
views.
Yes, this reflects my views. I'd like to read her statement. Okay. Since the pandemic started, so I'm just going to read her statement. I have admitted and cared for dozens of patients with COVID. Initially, there was a strong response with masks and distancing, and it flattened the curve. And remember, flattening the curve was meant to give doctors and nurses the ability to care for patients and have enough resources. And now I see the curves growing into giant spikes again. I diagnose new cases in my clinic regularly. I go into the hospital and see my patients suffering on the ventilator, and I have to call their families with updates. Of course, they all wish they could be there. Sometimes I have to give them bad news. One patient now needed dialysis. Another had a dangerous drop in blood pressure overnight, and worse yet, notifying their loved one had died. In fact, I had that happen this morning. I see the fear in my patients' faces when they're short of breath despite getting as much oxygen as we can give. Sometimes they ask me if they will survive, and I don't know the answer. All these patients are afraid, and they are alone. It is the worst thing I have ever seen my patients experience. I am overwhelmed. We are overwhelmed. No one is talking about flattening the curve. We need everyone to work together. We need masks, and we need vaccines. Thank you for allowing me to share this doctor's perspective.
Thank you. Our next speaker is Catherine Gower from North Kansas City.
Can you hear me?
Yes.
Okay, thank you.
Whenever you're ready, go ahead.
Okay. Thank you for allowing me to address you tonight. I grew up in Kearney and now I reside in North Kansas City. I'm the mother of 2 children who cannot yet be vaccinated. They attended school virtually last year to help protect themselves and their loved ones in their community. While we are thankful our children had the opportunity to attend school virtually, they're ecstatic to be going back to a classroom with their peers, and wearing a mask will not dampen their enthusiasm. They know that it's a small inconvenience to ensure that they can resume school in person. Tonight, you are hearing from 20 concerned citizens, and you will likely hear 20 different opinions from us. But public health decisions, especially those that impact our children, should not be decided by popular vote. We must trust the experts. I fully admit that I am not a medical expert, and I'm guessing that most of the other people speaking tonight won't be considered experts either. However, the majority of you, the Board of Trustees, are. You have at least 4 medical professionals among your ranks. So I'm asking you to trust the CDC, the AAP, and the evidence that these bodies have found to guide our decisions and protect every child in our county's schools and early learning centers. We know that in-person learning is best for both academic and mental health outcomes for our kids, but sending them into an environment that knowingly puts their physical health at risk is irresponsible. We have recently seen the Delta variant. The unvaccinated are substantially higher risk of getting severely ill or dying from COVID-19. In Florida, Texas, and even right here in Kansas City, children are getting sick in record numbers. A day camp in Johnson County that did not require masks was shut down after more than 40% of the children who attended tested positive as a result of their attendance. These are the outcomes we have seen happen, but you have the ability to prevent them here in Clay County. Masks are the most effective protection our unvaccinated children have right now, especially since social distancing is difficult for children and nearly impossible in our schools. Our children need you to use your expertise to make an evidence-based decision for our community, one that is not influenced by the politicized backlash against measures that have been proven to work. If you act right now before school starts, you can prevent hundreds of children, if not more, from becoming ill with a disease that can inflict significant, potentially lifelong damage. I urge you to ensure that every child has the opportunity to learn in a safe, healthy environment. Use the authority you have been given to require universal masking in schools until our young children can be fully vaccinated and positive case numbers fall to a more manageable level. Thank you for protecting our children.
Thank you. Our next presenter is Jay Richmond from Kansas City.
Raise your hand.
Hello, this is Jay. Can you hear me?
Yes.
Good evening, taxpaying citizens. Good evening, board. We, the citizens of Clay County, have offered you numerous resources, peer-reviewed articles, local data, testimony from medical professionals throughout the county to support mask choice. However, the Clay County Health Board has demonstrated they do not value our voices. It's a slap in the face to each tax-paying citizen to hold this meeting in a virtual format due to, quote, COVID rising cases. Missouri Health and Human Services dashboard shows the case rate for Clay County as of 8/6, that's August 6th, at 0.12% of the population. Let me say that again, 0.12%. This is not a pandemic. People are not dying in the streets, no matter how loud the woke mob screams. These actions and many more by the majority of the Clay County Health Board constitute misconduct in office, incompetence, failure to perform duties prescribed by law. Therefore, as a taxpaying citizen in this county, it is our duty to uphold Missouri Statute 77.650 and recall the majority of this health board. I want to give warning to Gary Zobrick, Courtney Cole, Patricia Dixon, Kathy Ellermeyer, and Dan Purdom that we, the people, will not stand for this tyranny. We, the people of the United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty to ourselves and our posterity, do ordain and establish this Constitution for the United States of America. In case you have forgotten, that is what Americans actually stand for. I know our country and our civil representatives, such as yourselves, have strayed far from it. But we the people is not a simple slogan. It is not something to just stick on a shirt. It has meaning. It is rooted in the blood of our brothers and sisters who have fought and died for this great nation, and we must do better. We must be better for our country. Ronald Reagan said it best, we the people tell the government what to do. It does not tell us. We the people are the driver, the government is the car, and we decide where it should go and by what route and how fast. Almost all the world's constitutions are documents in which governments tell the people what their privileges are. Our Constitution is unique. It is a document in which we the people tell the government what it is allowed to do. We the people are free. You do not rule us. In conclusion, I will remind the trustees on the Board of Health, it is your duty to implement public health programs and adopt public health ordinances designed to improve health for all who live, work, and visit Clay County. For all, not for some, not for those that agree with you, but for all. Your duty does not include mandating an agenda that supersedes our rights. Our constitutional medical freedoms allow us to choose any healthcare provider, choose any medication, choose whether we mask ourselves and our children. And that is exactly what we have been asking for, as a choice.
Thank you. Our next presenter is Megan Sims from Kansas City.
Okay. Okay, are you able to see me? Can you hear me?
I can hear you.
Okay, I'm new to this. This is my
Oh,
husband's
there
computer.
you go. I see you.
Okay. We can all agree with one thing, that what has us here speaking tonight is the safety of our children. We talked about OSHA guidelines, mental health of our children, CDC guidelines, and reference of your policies, and many more. We had parents of districts in Clay County come up and pour their hearts out to you. We had nurses, respiratory therapists, doctors, all who stood before you and repeated the same thing. Masks do not belong on our children's faces. Yet society still is led to believe that COVID cases among these kids are rising. Children are sick and the hospitals dying of COVID. RSV isn't a big deal. The eradication of influenza in the past year wasn't a big deal. Seeing your eye expressions could be the only thing that matters, and kids should be forced to wear a mask over their face. Masking children is in itself tragic, unscientific, and damaging. Surgical masks and cloth masks alone have dominated our lives in becoming contentious and quarrelsome symbol to remind everyone of the battle with SARS-CoV-2 or COVID-19. It's become politicized, and I believe everyone in this board has fallen for it one way or another. And yet students and young people are struggling mentally. Did you know 1 out of 3 of Arizona teens say that they need emotional support to improve their mental health this year? Did you know more teens have died of suicide than the coronavirus? Teenage girls alone have had a 50.6% increase in suicide attempts per CDC data. And yet studies are still coming out saying that students are the least likely to transmit the virus. And last night, the Kearney School District proposed a quarantine sequence and the highlight vaccination status and masks properly worn versus improperly worn. Are administrators really thinking that kids won't contaminate their own masks, that facial hair, runny noses, etc. won't make these masks disposable, and your mouth is the dirtiest part of you? In what ways do you think it is healthy for people to breathing in their bacteria continuously and not cause health problems of its own? 74,500, 385,000. What are these numbers? Those would be the amount of attendance at the Garth Brooks concert held at Arrowhead and Lollapalooza held in Chicago, Illinois. All unmasked, and vaccination status is unknown. And yet here we are discussing something you should have, without a shadow of a doubt, decided last week. It shouldn't even have been a question or tabled. Masks do not belong on our child's faces, and the choices should be up to the parents to decide what is best for our children. If Arrowhead can decide that a record 74,500 was right for their stadium, and Chicago officials can report it being the safest they've put on in years without no or little incidents, then your board needs to declare to not have a mandate in the Clay County establishments. Ultimately, it's your decision. It's not about us, it's about our children, and we know very well what you chose as your decision will impact our students. Please be like Platte County and Miami County and say no to masks.
Thank you. All right, our next presenter is Troy Pruitt from Kansas City.
Can you hear me?
Yes, thank you.
Okay, good. Sorry for the delay. We have tight security on our work PCs. So trustees, thank you for giving me the opportunity to speak tonight. We want to clarify important concepts regarding scientific studies and the practice of understanding, interpreting, and forming decisions based upon the information data reveals and how that data can inform your recommendations, which are part of your fiduciary responsibility on this board and citizens of Clay County. In our last meeting, we brought to your attention the serious error in the interim return to school and early child care guidance document located on your website. We are disappointed to see that as of Sunday, August 8th, that error has not yet been corrected. The problem with this citation is that it contains no data to support the recommendation that masks be worn in schools. It's essentially the CDC opinion taken as truth, and it's false. The lack of attention to detail by this board is a significant concern to citizens in Clay County who are counting on you to make sound, informed, evidence-based decisions. If you wish to endorse the wearing of masks to effectively decrease the spread of COVID-19 among children in schools, please share the study that proves that this is true and discuss the numerous studies that prove the opposite, that masks are ineffective. We encourage you to engage in an evidence-based scientific analysis and stand by the motto of the state, the show me state. Emotional appeals and unfounded fear don't help the kids. Stanislawski and Waterman wrote a series of efficacy on face masks relative to transmission of COVID, citing over 200 supporting peer-reviewed journal articles that demonstrate the harm caused by masks and ineffective ability of masks to prevent COVID and other viral respiratory diseases. Madwell et al. 2020 was a meta-analysis of 56 peer-reviewed masking papers. They were unable to statistically differentiate asymptomatic transmission. So in other words, asymptomatic transmission was not proven different from the number 0. Think about that. Additionally, all children-based transmission occurred from or to family with exposures occurring in the home, and all children's transmissions were symptomatic. These are the facts. COVID's never going away. It's a zoonotic disease cycle. Even if we were to rid the United States of it, other countries are not they're not vaccinated. Even if we successfully vaccinated every citizen the exact same day, the disease can still be found in cats, dogs, minks, camels, bats, and many others. In closing, we wish to remind you of your fiduciary responsibilities as elected officials and members of the medical community. First and foremost, we count on you to do no harm, and second, to treat us with care and respect for our beliefs and values toward our own health and well-being. It's frightening to consider that this board in the last meeting failed to produce evidence to support possible COVID transmission mitigated protocols and instead insisted that peer-reviewed published journals were merely anecdotal. Our society is in a fight or flight mode. We're going to stand or we're going to retreat.
Our next presenter is Marissa Vlasen.
Hi, Marissa. If you're on, can you please raise your hand? I am not seeing your name in the participant list. If you raise your hand, I can unmute you.
Okay, hello. Hear me okay?
Yes, thank you.
Okay. Hello, my name is Marissa Vlasen, and I work as a behavioral healthcare navigator in Liberty Hospital's primary care clinics. I am a graduate level Missouri licensed social worker preparing to advance to a clinical license. I work with patients from infancy to elderly and their families. I've been in the Northland for over 3 years and now call it home. Throughout this pandemic, we have seen much more than physical health suffer. The mental and emotional and even spiritual health of our community has been greatly impacted, and to ignore these aspects of wellness would be naive and borderline dangerous. We have seen an increase in not only diagnoses of mental health conditions, but also suicidal ideation and even attempts. These could be new problems or lifelong struggles only magnified by the stress of a global pandemic and its effects. Our adult population and older adults especially have felt anxiety, depression, isolation, and grief, but our youth have been traumatized in unique ways as well. Some have lost family members, struggled through fear of transmitting disease to others, or catching it themselves. They've also had to endure the huge strain virtual learning placed on their education and school-based relationships. Children have already proven they are resilient, oftentimes more so than adults by far. They adjust well to change with love, guidance, and patience, and have shown us they can successfully wear masks throughout the school day. We have no proof that masking causes learning or behavioral issues. We do know that a large number of our students struggled and were distressed by forced virtual learning. They were safe, but they were not thriving, and we saw that in our clinics. As stated previously, the increase in suicidal ideations and unfortunately attempts were observed in my position throughout our area as I work in 4 separate sites throughout Clay County. These are our patients, but they are also your neighbors, friends, and even family members. Masking our students keeps them in the classroom, helps them maintain their friendships and see their role models, and participate in enriching extracurricular activities. I believe that will all further contribute to overall improved behavior health in our community's children's and families furthermore. Successful physical health cannot occur if the emotional health of a person is compromised and vice versa. They impact each other. Keeping our kids, and might I add, our educators, safe will contribute to the community's improved well-being. We must act in accordance with science and facts rather than opinions. We must think in terms of a community as one Northland, beating this pandemic and creating a new, healthier normal. I encourage the board to vote for masking in our schools and early child care centers for the health of not only our students, but our community members as a whole. Thank you for giving us the opportunity to speak, and thank you for your services as board members.
Thank you, Marissa. Our next speaker is Angela Mason from Kansas City.
Can you hear me?
Yes.
Okay. First off, I want to thank the board for everything you've done up to this point to keep our children safe in school. I know this is a tremendous responsibility that has been laid on your shoulders. I have 2 kids under 12 in the Liberty School District right now. I could sit here and cite all kinds of statistics and articles about how bad things are in Missouri right now with percent positivity and case rates and hospitalization rates and all that, but that's all information you guys probably already know. So instead, this is what I want to use my time to say. When I'm sick, who do I go to? I go to my doctor for advice and treatment plans. It's the same thing with my children. When they're sick, I go to their pediatrician to figure out how to make them better. What I don't do in these situations is go to Facebook, Google, Twitter, any form of social media. What I want to hear from is licensed medical professionals with medical degrees. So in the midst of this pandemic, you're trying to make the best decision you can in order to keep my children safe so they can go to school in person this year. So who do I want you to turn to right now? Not me. I don't have a medical background. And I'm going to guess the vast majority of people that have spoken at your meetings over the past year or so don't have backgrounds in epidemiology or infectious diseases. So I would rather you reach out to the infectious disease specialists and the epidemiologists locally and nationally to figure out this decision. Talk to the doctors at Children's Mercy in Kansas City to see what they're seeing and how they think. Talk to our local pediatricians and our doctors. These are the people whose advice I want you to use when you make the decision on how to keep my children safe until I can get them vaccinated. These people and these groups are saying universal masking is what's going to keep my children safe, then let's do it. If we need a mask mandate to keep my kids safe, I'm fully okay with it, and so are they. We've talked about it, and they're fine wearing a mask. At the end of the day, people are going to be angry no matter what you do. So we might as well make this decision based on medical science rather than emotions. Emotions won't keep my children safe, but I have faith that science will keep them safe. So please listen to science and listen to the people who have the credentials to give you the information you need. Thank you for allowing me time to speak tonight. And once again, heartfelt thanks for all you've done up to this point to try and keep my children safe from COVID. I appreciate your efforts. Thank you.
Thank you, Angela. Our next speaker is Joshua Hyde from Pleasant Valley.
Yep. Am I coming through?
Yes, Joshua.
Okay. So let me start off by thanking the board for their time and energy on this matter. Throughout these proceedings, we've heard a lot of information. Masks don't stop the coronavirus from spreading. Children are no risk of death from coronavirus. If you want to wear a mask, wear one, but don't force someone else to. And that this is about a parent's right to choose for their child. All these things together, we're told, means we should not mandate masks in schools. Opponents to masking point to a lack of immediate reduction in cases after mask mandates are installed. They misunderstand that any mitigation will have a delayed effect because of the incubation period of COVID. Additionally, they misunderstand that the mandates are often flouted by people or not practiced properly. Ignorance about masking undermines these efforts. Opponents point to the idea that masking alone is not sufficient to stop transmission, and they misunderstand that masking is but one of a part of a set of tools that we need to employ to mitigate the spread of COVID. Even if we are unable to employ that full set of tools, we should still use the tools we can, such as masking. Opponents point out that the coronavirus is small enough to get through the holes in masks, but they misunderstand that it is the water droplets carrying the virus, not the virus itself, that masks stop. Humans do not exhale standalone virus particles, we exhale water droplets carrying the virus. Opponents point to studies, such as in a previous meeting, an alleged Johns Hopkins study that said no children die from COVID. They misunderstand that Johns Hopkins never published such a study. A report was posted by a professor who merely works at Johns Hopkins School of Medicine, and it only examined 3 of the over 400 deaths of people aged 18 and under that have been attributed to COVID. In contradiction to this alleged study, Johns Hopkins Medicine's own website says, in rare cases, children can become very sick with COVID-19 and deaths have occurred. These alleged studies are either misconstrued or have poor methods with wrong conclusions. Opponents misunderstand the function of masks in schools. They focus their arguments around children experiencing less severe symptoms than adults. This focus on children's symptoms, though, is missing the point. We are trying to prevent classrooms from being spreader events. If little Susie catches COVID at her friend's house and doesn't know it, we want Susie wearing a mask at school so that she doesn't infect her classmates. It only takes one infected child without a mask to infect an entire classroom and increase the chance of new variants. Opponents will say that other people are welcome to wear masks, but they won't and don't need to. They misunderstand that masking requires the whole classroom to mask, not merely some of the whole. This is because masks do not protect the wearer, they protect others from the wearer. I'll repeat, it only takes one infected child without a mask to infect an entire classroom. Ultimately, this is not about a parent's right to choose what's best for their child. Opponents are asserting the privilege to choose what's best for their children's classmates and their families. With rare exception, we do not accept the parent's choice rationale for mumps, measles, or other vaccinated diseases. Given that the Delta variant is 2 to 3 times more contagious than the original disease, we must use masking if we want children to return to in-person learning. Thank you for your time.
Thank you, Joshua. Our next presenter is Robin Morris from Liberty. Robin, we can't hear you.
Robin, you'll just need to unmute yourself. I turned on your mic, but
Okay. Robin, I'll put you at the bottom, okay? And we'll come back to you. So the next presenter then will be Stephanie Green. Stephanie's from Liberty.
Can you hear me?
Yes, Stephanie, we can hear you.
Okay, perfect.
Go ahead.
Thank you. Thank you for the opportunity. I am the mother of 4 children under 10 who cannot yet be vaccinated and who did virtual school last year so that we did our part in trying to control the virus. My kids are really looking forward to in-person school, but this will only happen with masks. So I just wanted to come today and express my support for having masks be required in schools at a minimum until the vaccines are readily available for kids. Every single doctor I have spoken with shares the exact same viewpoint. The priority should be keeping our kids in in-person school. And to do that, we need to mitigate the spread to keep kids from having to constantly quarantine. If our community numbers were similar to this spring, this may have been a different discussion, but Delta has changed things and it is affecting kids more than ever before. Furthermore, our kids' mental health is important. I have heard from a local Harvard-trained child psychologist who says he has not seen one instance of a child having a mental health issue from wearing a mask. Contrast that to the large increase in mental health issues in children that occurred when they were all in virtual school, and the decision is pretty clear. We live in a society where we all have to follow guidelines for the good of others. We have speed limits to follow to keep ourselves and others safe. Requiring masks follow the exact same logic. We all know that masks protect the people we are around more than the person wearing it. This is the same as speed limits. Also, COVID isn't the only thing to consider. Masks keep our kids healthier than they would be otherwise. The decrease in flu and other respiratory viruses last school year prove that. These spots tonight were taken within 5 minutes. So, you know, it's interesting that you had it. However, it's hard to say who was able to get those spots. Many doctors were with patients at that time. And although I am voicing my opinion, I want to express that the guidance from our local physicians should be considered more important than the opinions of the public. They are the ones who truly understand all the dynamics at play. They are the experts. We should listen to them and follow what their recommendation is. Thank you for your time.
Thank you. Our next presenter is Ashley Bro. Hope I'm saying that right. Ashley, I'm sorry, from Kansas City.
Hi, you did say my name right. I'm a parent of 2 children in the Liberty Public School District. I'm also a family nurse practitioner. I care for students and their families as well as employees of many districts in the Kansas City area, though I do practice directly in Liberty. I'd further like to mention I have a young child at home who's suffering cardiac complications from COVID-19, who is a previous healthy young lady without any risk factors. We did do everything correctly. I'd like to personally urge you to consider mandating masks and other mitigation efforts, as it's going to take more than just masks to continue those strategies based upon evidence and certain criteria, such as the previous gating criteria used. We all understand Delta is a game changer. In step with that, we know our community's positivity rates higher than a year ago, and our youngest children, as well as too many of our older children, do remain unvaccinated. I do not find that with a worsening pandemic, doing any less would be acceptable at this point. We know wearing even a simple mask decreases respiratory droplets by at least half. This strategy did work during our last school year. We can see how little infections there were and how little quarantine there was in spite of huge community surges. Evidence supports universal masking and is crucial. We know we're sitting at 264 cases per 1,000 in Clay County with previous criteria at 100. We have high community transmission. The impact of COVID-19 on children should not be ignored. Serious disease and death does occur. While we see a survival rate, we also know it was a leading cause of death in the last year. Evidence shows 30 to 50% of previously infected children will suffer something long term. We know children's mortality is 2 times at their rate of our last community peak last year, and it's really not acceptable that we have any children in their ICU right now, in my opinion. I understand not everyone wants their child in a mask. I also believe we all want our children in school. For us, we can all agree children should be in school. Masks are going to be the way to keep our school open. It's a defeating philosophy to not want masks in our children, but to want our children to remain in 5 days a week, all sports and all curricular activities. Without universal masking, and other approaches like distancing, hand washing, contact tracing, there will be significant illness and spread to vulnerable people, disruptions in attendance, canceled games, activities, and players missing important things. The need for parents to be at home schooling their children will impact their financial well-being as well as our local economy. Wearing a mask is not an individual choice, even if we want it to be. It directly affects the people around us as well as our entire community on a daily basis. We're not wearing masks because we enjoy it. We're doing it because it's simply the best way to protect our children. For those advocating for personal choice over community health and safety, I'd like to remind you that we keep nuts out of our school because it saves several children's life annually. And it's not just an only number. It's every single death that a child has prematurely is not okay. I'd like to thank everyone for their time.
Thank you, Ashley. Our next presenter is Natalie Shoal from Kansas City.
Natalie, can you unmute yourself, please?
Natalie, we see your hand raised and we see your icon, but you are muted on your end. Can you unmute yourself? Natalie, I'm going to go ahead and go on to the next presenter. You try to figure out how to unmute yourself and I will come back to you. Okay. The next presenter then will be Lisa Avery from Gladstone. Lisa, I can see you, but you're still muted.
Oh, there you go.
There you go.
Yeah.
Okay, awesome. Can you hear me now?
Now we hear you.
Excellent, thank you.
You're welcome.
Hi.
Go ahead.
Thank you guys for letting me speak tonight. I'm a pediatrician at Priority Care Pediatrics here in the Northland. We are a group of 19 pediatric providers within 3 offices. My colleagues and I proudly care for a significant number of children who both live and go to school in Clay County. We acknowledge and are empathetic to the reality of COVID fatigue and the significant way in which the pandemic has affected all of our daily lives. That being said, my colleagues and I, along with the CDC, the American Academy of Pediatrics, and locally the infectious disease experts at Children's Mercy, believe that masks should be mandated in all K through 12 schools for the start of the upcoming school year. While many children experience fairly benign disease when they become infected with COVID, it is now the 10th leading cause of death for children in the U.S. And as of August 4th, 416 children have died from COVID. These are not nebulous children. These are our children. That's equivalent to the graduating class of Oak Park High School for 2022. This is more than the number of children who attend Franklin Elementary School and more the entire staff and student body of Kearney Elementary. It is a horrible, inexplicable experience to watch a child die on maximum ventilatory support. I remember each patient vividly whose death I've witnessed, but that pales in comparison to what the families experience. When a child dies, the immense void left in his or her absence can never be filled. 416 deaths is too many. We are not willing to sacrifice anymore. We are concerned about the surge of the Delta variant cases in Missouri affecting primarily unvaccinated children, and that transmission between both vaccinated adults and students and between unvaccinated students. In speaking with our colleagues, hospitals in the Kansas City area are at or near capacity and across the state, including Children's Mercy. And this is particularly worrisome for us leading into the new school year. Masking will definitely help prevent or reduce the potential number of cases so that our hospital systems will not be overwhelmed and can continue to provide care. From a mental health and academic standpoint, we know that in-person learning is best over virtual learning. And without a mask mandate in place, kiddos will have to quarantine possibly multiple times over the school year with whole classes and even multiple classes in the middle and high school level. So as physicians and as parents and as people who have dedicated our lives to promoting the health of children, my colleagues and I at Priority Care implore you to mandate masking until COVID-19 vaccine is available for children 2 through 11 years of age, and a significant number of children have completed the series. Mandated masking will prevent the spread of COVID-19 and is a fairly benign thing with benefits that far outweigh the discomfort of wearing a mask. Just as we've implemented peanut policies in schools to save the lives of a handful of children, we also view masks as our duty to reduce the risk of morbidity and mortality of the people around us. It's our humanitarian duty.
Thank you. Thank you for the presentation. I'd like to go back to Robin Morris, if I can, from Liberty. Let's see if she's been able to get her mute unmuted.
Hey, Pat, I think I saw Kevin Manning available too at one point, so circle back around to him.
He's already spoken.
Oh, I'm sorry.
He spoke first.
Can you hear me?
Yes.
Oh, good. Thank you. I'm ready for my timer.
All right.
Thank you. Good evening to the members of the Clay County Public Health Board, and thank you for allowing me to speak with you here tonight. I know this has been a long decision-making process and that you have heard from many local folks about their opinions on the topic of masks in schools. My name is Robin Morris. I'm a family physician who works at the Liberty Clinic. I've worked at my clinic for over 20 years. I've delivered well over 1,000 babies in our community, and I take care of many patients that live and work in and around our Clay County community. The group I proudly represent tonight, the Liberty Clinic, is a group of 14 fantastic primary care physicians who altogether have over 100 years of experience caring for patients here locally. We are invested in this fight against COVID. We live and breathe behind our masks at least 8 hours a day, many of us more than that. We see positive patients every day in our clinic. We round on them at the hospital, and we break bad news to families about their loved ones. As one of the largest primary care clinics north of the river, our physicians advocate 100% for masking our K-12 students in the Clay County area. Our low vaccination rates continue to drive up our hospitalizations and patient volumes within the clinic and make it so challenging to provide healthcare right now. Healthcare workers are overwhelmed with the onslaught of patients that we are seeing. If students return to school without mask mandates in place, it is likely that the surge that will come with that will be nearly unmanageable for us. Right now, it is already difficult to get appointments at local urgent cares or primary care clinics for evaluation and testing of patients. The COVID tests that we send to outside laboratories are taking longer and longer to come back because their volumes have increased steadily as well. The Centers for Disease Control and American Academy of Pediatrics have recommended K-12 masking for teachers, staff, visitors, and students in order to protect our youngest and most vulnerable students, those less than age 12 that are unable to be immunized at this time. Our North Star, our principal guide and guiding principle in all of this needs to remain student safety and keeping kids in school in person as much as possible. With low vaccination rates and rising numbers of COVID positive patients, the best way to do this at this time is to lead by example. It's time for Clay County to lead by example. The physicians of the Liberty Clinic ask that our Clay County Health Department board set aside the noise you've been hearing, set aside what you've been hearing from a vocal minority. Set aside the rhetoric you've been getting. Set aside the Facebook science that many folks are trying to push as truth. We need you to focus on the published science, the accurate data, the epidemiologists that have led us this far through the pandemic. Please endorse masking for school districts and early childhood ed centers and keep our Clay County kids healthy and in school in person. Thank you.
Thank you. All right, our next presenter is Natalie Shoal.
Can you hear me?
Yes.
I was unmuted earlier. Clay County Health Board, for months now, we the people have been logging into your virtual meetings and showing up at our public health building that we the taxpayers pay for. For 18 months now, you have overstepped your authority. You've hurt businesses, your decisions have put people out of work, and you've harmed our children. And tonight, you went virtual so you could pick and choose your speakers. I am so disgusted with the doctors talking about injecting our children with unapproved shots. I'm not going to speak for 3 minutes. I'm not even going to use this 3 minutes to give you data or science because we've been doing that for long enough. You are not listening. It's clear this health board has zero credibility because you follow no science. You follow corrupt private agencies like the CDC and the AAP that you know are funded by big pharma like Pfizer and Bill Gates, yet you refuse to research the truth and continue your ridiculous narrative. On your own website, it says a cloth mask offers some protection to you. Well, what is some? How is that science? You think our children should wear filthy cotton masks because the CDC says it may help offer some protection? Well, that is not good enough. We, the people, will decide how to protect our children. And on your website, you still haven't added the risks of these vaccinations. People are dying, they're becoming permanently disabled from these shots, and you still refuse to put the risks on your website or any VAERS data at all. You are negligent. Health Board, you are guilty of malfeasance. Dr. Purdom, you're guilty of violating your Hippocratic oath. Dr. Gates, you're the only hope for this board moving forward, and we hope that you will stay the course and do what's right for the people of Clay County. We are watching and we are listening. All we ask for is mask choice. Parents who want to mask their children, fine, mask your children. But for those of us who know that masking children is not effective in stopping any virus, give us that choice. And one thing I can promise you right now, we the people will not stop until each and every one of you is gone. We're going to replace all of you with not only qualified people, but qualified people that will actually listen and seek the truth. You have proven to us that you are nothing but fascist, and we will not stand for it. That is all.
Thank you, Natalie. Our next presenter will be Sarah Parrish. Sarah Parrish, if you'll raise your hand.
Pat, I'm not seeing a Sarah Parrish on the attendees list here.
On the standby, if time remains, and we have time remaining. I'll go to the next one, Dr. Dick Gregory. Do you see him, Daryl?
I am not seeing him either.
Okay, I'm going to go ahead and close the public comment period then. The purpose of the meeting tonight is to review the document titled COVID-19 and on-site learning guidance for schools and early child care centers. Make any recommendations for change to the document and to vote to accept or reject the document with or without changes. I would like to start by having Gary give us a review of current cases. Gary.
There we go. Can you hear me?
You're kind of spotty.
Can you all hear me now?
You're breaking up.
All right. Sorry. Can you hear me now?
Yes. Better.
Better?
Better.
Okay. So I will be brief. So I just want to give you a general summary of what's happening recently. So cases have risen.
I think you've frozen as well as broken up. Gary, we're not hearing you and you're frozen. Your screen has frozen.
Can you hear me now?
We hear you, yes.
Sorry, I apologize for that. I'll try to be brief. Let me just review the current situation. Cases have risen 34% weekly for the last 2 weeks. Last Friday, the KC metro area, which is both Kansas and Missouri, hospitals, chief medical officers provided an update to local leaders and public health officials on the current state of affairs in terms of hospitalizations. And here's what we have as of today. And I check with the hospitals regularly. Today, as of this afternoon, Liberty Hospital, total of 33 patients. ICU, 8 of those are in ICU and 7 are on ventilators. North Kansas City Hospital has 73 COVID patients right now, 19 in ICU. 11 of those 19 are on vents. Children's Mercy Hospital, Last week, 301 patients tested positive for RSV, while 303 patients tested positive for COVID-19. That includes both outpatient and inpatient. Currently, 14 patients are in the hospital with COVID. They have children in both the pediatric intensive care unit and the neonatal intensive care unit. That's as of this afternoon. In June, we were at 342 cases in the month. In July, that rose to 912 cases. That's a 166% increase in 30 days. If you go to our website, you can break down by age group. And I will tell you that the age group of 5 to 14-year-olds, the cases as of August 1st they have escalated to the point where they were in January of this year, after a steady decline over the spring and beginning of summer. On 15 to 24-year-olds, it's the same scenario, a rapid increase in July and up to the 1st of August. And in that age group, we are also at levels that were in January of 20 for the spring and the beginning. In terms of the total vaccination rate for the population, we are at fully vaccinated 16 and up. Currently is 42% of that population. We're at, for 65 and up, we're at 65%. So that's kind of the quick numbers in terms of the breakdown.
Okay, thank you. After last meeting, Dr. Purdom and Dr. Gates put together a question that we submitted to the Department of Health and Senior Services for the state of Missouri. We submitted to Children's Mercy Hospital, North Kansas City, and Liberty Hospital, asking their infectious disease staff to respond. The question was, for the 2021-2022 academic school year, shall a student who tested positive for SARS-CoV-2 by viral testing NAAT, most commonly RT-PCR, antibody, parentheses, serology testing for SARS-CoV-2, or T-cell testing, T-detect, excuse me, T-detect, T-spot, etc., be considered the equivalent of vaccinated for the purposes of this guidance. We did submit that question, and I would like to share the responses from those who reviewed this question and responded to us as the board, for the board. We got a response from Jess Pearson, who is in MPH, he's the epidemiologist for the Northwest District of the Missouri Department of Health and Senior Services. His response was, in short, antibody testing should not be used to show immunity and exclude students from quarantine at this time. Dr. Kenna Belshi from North Kansas City responded that their answer was no. Jennifer Schuster from Children's Mercy Hospital responded, no evidence or role for using these tests to state vaccine equivalency. Only caveat around this is that CDC still considers that you do not have to quarantine if you are exposed to someone with COVID-19 within 90 days of a previous infection with a documented positive test. If symptomatic, test and isolate. She also included that Children's Mercy Hospital is seeing kids with reinfection, so it seems that immunity from infection is not long-lasting. Similar to other respiratory infections is what she likens it to. And then Dr. Adiga from Liberty Hospital responded totally disregard the antibody T cell test at this time, especially in the specific area of determining one's immunity to COVID. No to no quarantine for kids with positive antibodies. Limited quarantine can be considered, but is risky to allow early return. Still should wear masks. So we did hear from North Kansas City, Children's Mercy, Liberty, and the Missouri Department of Health and Senior Services. At this time, I would like to suggest that we review the suggestions from the board members related to the guidance, the guidelines. Let's see. Dr. Gates, you gave us some feedback on what you would like to have. Your guidance or your suggestions start on page 6. And you have a suggestion that would go under the quarantine of exposed contacts. And what you've said is, please consider adding the following suggestions to both the fully masked and partially masked or unmasked columns on page 6 in the table, quarantine of exposed contacts. And your suggestion is individuals who have had a laboratory confirmed PCR test, COVID-19 illness, and fully recovered do not need to be quarantined if they are subsequently exposed within the next 3 months and do not have symptoms. Discussion on that?
Hey, this is Dr. Pruitt. Dr. Gates, was that recommendation based on those interim guidelines for COVID-19 antibody testing from March of this year that you forwarded to the board this morning?
Yes. Before I start, I just want to say that any remarks or actions that I make while serving on the board of trustees of the Clay County Public Health Center are my opinions and are not the opinions of Liberty Hospital or North Kansas City Hospital or the physicians on the staff at these hospitals. And I also want to thank Pat Dixon for calling this meeting so that we could get something put together before school starts. And of course, all the board members that are serving tonight. And I want to thank the staff at Clay County Public Health Department for getting the information that was requested at the last meeting. And so in answer to your question, regarding the page 6 suggestion, that first bullet point that was just read came from within the document itself, page 10 on that. It's on page 10. You want to pull that up. It's at the bottom of the page.
It's under quarantine, which is section 2.
So the request on the first bullet was just to include that in the table because it was written as a statement within the text of the quarantine.
It's the very last paragraph.
So I spent some time going through this today, and first of all, I want to thank Gary and the staff and everyone who worked together to put all this together. And I understand I think we want to keep, I think we all agree that we want to keep kids in school as much as possible. My concern is with adopting this language, and the reason at this point, at least, I don't support that is when you look at the guideline that Dr. Gates sent out from March 17th from the CDC, and I'm looking at the very last bit here where it says under additional considerations for serologic test results. The third one down, it says unvaccinated persons who have tested antibody positive within 3 months before or immediately following an exposure to someone with suspected or confirmed COVID-19 and who have remained asymptomatic since the current 19 exposure do not need to quarantine in low risk situations. And so, and I think that's important. If Dr. Gates and I were in the office together and it was just the two of us and he had an exposure and I'm vaccinated and I didn't have any chronic health issues, it'd be a concern. That's kind of low risk, and sure, I think that would be very appropriate. The problem is that we have to have an actionable document for the schools. And when you look at it, and it says basically low risk means they're not going to come into high contact, or they're not going to come into contact with high risk individuals for at least the next 10 days. And when you look at the who's a high risk person, in addition to the elderly, pregnant women, people with chronic medical conditions, including asthma, people that may be undergoing treatment for cancer, that sort of thing. Even obesity, which we know is a significant issue among our children in schools. I just think, honestly, that's a lot to ask of school, to parse through all of that and figure out each and every child in each and every classroom, whether they're going back into a low risk or high risk population. We have a lot of high risk people in our school districts. And I just don't think making that change buys us anything. And I think it complicates the picture dramatically for the schools. I just don't think it follows the current guidance that's out there from CDC. But that's my opinion.
Dr. Pruitt, the first bullet that's within the document, would there be a problem putting that in the table?
Adding the individuals who had a laboratory confirmed illness and fully recovered do not need to quarantine if they are subsequently exposed within the next 3 months and do not have symptoms. Is that what you're referring to, Dr. Gates?
Yes, and that's from within the document, but it wasn't put on the table. And so I just wanted to be consistent. We should probably either have that in the table or remove it from the text of the document.
I believe that is current CDC guidance, and I think it was just inadvertently left off the table.
So you'd be okay with putting that on the table?
Yeah, that's what school districts have been following. They get a 3-month exemption if you've tested COVID positive. You have a 3-month exemption from quarantining as a close contact. That is how we've been practicing school districts for since that recommendation came out by the CDC, and that is supported by Children's Mercy in their guidance as well. And it's what we've been following in Clay County's guidance since it came out.
And that guidance assumes that the students were masked at the time of the exposure. Is that correct?
That is a good question. I think that I think that's if they are just subsequently exposed. It's kind of it follows the same line as a fully vaccinated person. So if you're fully vaccinated, you have an exemption if you are named a close contact, and if you are, and if you have had the disease. And I need to look at that table, but that's what my understanding is, or recollection. We might need Ashley to speak into that a little bit, but let me look.
On page 10, Dr. Purdom, it does state that if the school has implemented universal masking and appropriate masks are being worn correctly by both individuals during the time of exposure in the school setting, the individual who came in contact with the person with COVID-19 can continue to attend school and participate in school-related activities, so long as they can wear a mask and maintain social distance. That's part of that quarantine statement. Yes, you're correct.
Okay. Well, if Kathy's most in touch with the school districts and what they're looking at in terms of their documentation, if she's okay with that going into the table, I'm fine with that too.
Okay. So then what I heard was that second section you were not comfortable with. The unvaccinated person who have tested antibody positive within 3 months before or immediately following an exposure to someone with suspected or confirmed COVID-19 and who have remained asymptomatic since the current COVID-19 exposure do not need to quarantine, provided there is limited or no contact with persons at high risk for severe COVID-19 illness, including older adults and persons with certain medical conditions.
Yeah, that's my concern is that,
Okay.
Yeah.
Right. The at risk. And I know Kathy has shared previously that they do have a lot of at-risk students at school.
Yeah, I share that concern. It's just with the way that is worded on the CDC in the guidelines, it would be impossible for us to do that because of the numbers of staff and students that are high risk that we that would have exposure.
Okay, so if we leave that where it is right now. Dr. Gates's next recommendation was page 8. Please consider adding the following to the first paragraph, and that was on penalties for children staying home. His suggestion is grade penalties for absences due to illness or quarantine, such as lowering grades for missing a certain percentage of total classes of a subject, should not be used during the 2021-2022 school year.
I'm not a huge fan of telling schools how to determine competency or progression of their students. I think we can talk to them to speak to keeping them safe from a health perspective, but honestly, I don't have a problem with that being in there. And if we add it, I would be okay with that and could support that.
Okay. What they have is perfect attendance awards should not be used during the 2021-2022 school year.
Yes, that would be continued. This would just be in addition to that.
Okay.
I don't think that they did grade penalties last year because of the situations that arose, but this year is kind of a transition year. Hopefully next year we'll be beyond this, but for this year, I just don't want to, I don't want a child who might be ill thinking, well, my grade will go down, I'll go to school, and then more people would be possibly exposed. I don't want an incentive for kids, unfortunately, to try and get to class when they're not feeling well.
I think that's very fair.
Anyone else on that particular point? Then under that same section, you wanted to consider the final sentence of paragraph 5 to be changed to the following, where it says limit any non-essential visitors. You wanted limit any non-essential visitors, volunteers, and activities involving external groups or organizations with people who are 1, not fully vaccinated, or 2, have not had a laboratory confirmed PCR test COVID-19 illness within the past 3 months, or 3, who have not tested antibody positive within 3 months before the school visit, as much as possible, particularly in areas where there is moderate to high COVID-19 community transmission. And so essentially you're adding number 3 to what they have. You're detailing the
Right. I think this is the same issue that Dr. Pruitt and Kathy have voiced concern about, that it would be hard to operationalize this, and there are individuals that are high risk. So I hear their concern regarding that.
Okay. I think the first part of your recommendation is already there. It's that number 3 that adding that is going to be very difficult for schools to be able to have people prove or be able to follow up. Yeah, the MI. Oh, sorry.
Yeah, it's just difficult to prove that like that.
So currently that then says limit any non-essential visitors, volunteers, and activities involving external groups or organizations with people who are not fully vaccinated as much as possible, particularly in areas where there is a moderate to high COVID-19 community transmission. Schools should not limit access for direct service providers, but can ensure compliance with school visitor policies.
Yeah, that's good.
So am I hearing that you want to leave that the way it is?
From my standpoint, yes, that would be, school districts can operationalize that well.
All right, Dr. Gates's next recommendation is on page 11. I think it starts on number 10 on mine, quarantine. The first paragraph.
I'm sorry, Pat. To go back to that, I want to make sure I'm trying to track all these changes. So the bullet point that says limit any non-essential visitors, volunteers, and activities, did the board want that entire statement added, or part of it? I wasn't clear on that.
What I heard was no,
No to all of it.
to leave it the way it was stated. Because
Oh,
everything is in there except number 3.
okay. Thank you.
So then on page, it's my page 10, section 2, quarantine, first paragraph. Please consider replacing the final sentence of the first paragraph with the following. Unvaccinated persons who have tested antibody positive within 3 months before or immediately following an exposure to someone with suspected or confirmed COVID-19 and who have remained asymptomatic since the current COVID-19 exposure do not need to quarantine, provided there is limited or no contact with persons. And again, that goes to the high risk. With persons at high risk for severe COVID-19 illness, including older adults and persons with certain medical conditions. Section 2, quarantine. Section 2 of the first paragraph reads, currently reads, quarantine. Keep someone who might have been exposed to the virus away from others. For COVID-19, quarantine is for 14 days from last contact with a person with confirmed or suspected COVID-19. The last sentence then is, this could be greater than 14 days, depending if the person with COVID-19 was unable to isolate from the exposed person, such as caregiver and child, or if additional exposure with COVID-19 positive persons occurred, such as multiple household members.
That is currently how districts practice, and Children's Mercy as well. We do know that when COVID gets into a household, it typically will sweep through that household. Not always, but often it does. And that's been a very reasonable quarantine measure. I know that's the CDC guidance. So I don't know. The other just is the antibody concern again, I guess, with the high risk individuals. So.
And I also think, honestly, we've been talking about this new Delta variant, and, you know, I sent out some information about reinfection rates and things like that. I mean, I think there's more, we're seeing more breakthrough and more reinfections and breakthrough infections of people who are vaccinated with this new variant. So I think we do end up having to be on the side of caution with that one. I don't know that we can modify that much further.
Okay. Then what I'm hearing on that is a no at this point. We'll circle back to these as we get to a motion. Page 12, section sports and other extracurricular activities. Dr. Gates has asked that we please consider changing the third and fourth sentences of the second paragraph to the following. And in the document you have the third and fourth sentences are: students who are not fully vaccinated and participate in indoor sports and other high-risk activities should continue to wear masks and keep physical distance as much as possible. Schools may consider using screening testing for student athletes and adults, such as coaches, teachers, advisors, who are not fully vaccinated, but who participate in and support these activities to facilitate safe participation and reduce risk of transmission and avoid risking in-person education due to outbreaks. That's the Is that where you were looking, Dr. Gates, to put that?
Yes. You know, here again, I share the concern that was mentioned about the operationalization of the antibody testing. And also I do share the concern of any breakthrough cases among those that have previously had the infection or otherwise. And so I understand that. Can you read off read off what it says again for the statement for that section that's previously written in the document?
That section for those sentences, it says, students who are not fully vaccinated and participate in indoor sports or other higher risk activities should continue to wear masks and keep physical distance as much as possible. Schools may consider using screening testing for student athletes and adults, such as coaches, teachers, advisors, who are not fully vaccinated, who participate in and support these activities to facilitate safe participation and reduce risk of transmission and avoid risking in-person education due to outbreaks.
Yeah, I mean, the concern I have, one of the concerns is that we're segregating the vaccinated from the unvaccinated. I would prefer that the beginning of the sentence be all students, so that we're treating all equally, that we would obviously like all students to enjoy the same protection and also to be able to protect others. And so I would prefer to say all students. And so I'm not sure how we would put that in there, but the first part, differentiating vaccinated and unvaccinated, I think the American Academy of Pediatricians is talking about all students should be wearing masks, and the CDC has said that as well. So I would think if we're going to I just am concerned about treating populations differently.
I think that's a good idea to just to name all students, and schools have some leeway there. I like the statement that as much as possible, that's already in the guidance. That gives schools some leeway to be able to differentiate if there's an extremely high intensity activity, that then they have some room to work within that if there's a lot of exertion that's really difficult with a mask. And so that would, I like that all student, the all in there rather than.
So Dr. Gates's recommendation was to put all students who participate in indoor sports and other higher risk activities should continue to wear masks and keep physical distance as much as possible. Schools may consider using screening testing for student athletes and adults, such as coaches, teachers, advisors, who are not fully vaccinated. And then he had put in a caveat of, with the exception of those that are, 1, unvaccinated persons who have had laboratory confirmed PCR test COVID-19 illness within the prior 3 months and fully recovered, or 2, and number 2 goes to the antibody issue. Unvaccinated persons who tested antibody positive within 3 months and who remain asymptomatic, who participate in and support these activities to facilitate safe participation and reduce risk of transmission and avoid risking in-person education due to outbreaks.
So, Dr. Gates, I just want to clarify. It sounded like you were, because of the challenges around getting this operationalized, you were willing to drop the antibody part of what you were talking about earlier, but you wanted to change this to all students. I'm just trying to clarify here. Is that
right? I understand. I've heard and I understand your concerns, the board's concerns with the antibody situation. So yeah, I'm willing to have that part removed. But I'd like all students to be treated the same as if they were indoors. If they're being treated the same indoors, I think they should be treated the same way and treat others the same way in indoor sports and high risk activities. That's all I'm saying there.
And I would support Dr. Gates' position on that. I think he's quite correct. And when we look at the breakthrough infections we're seeing and that sort of thing, probably treating all students the same and having all students doing mitigation at this point, I think I think he's absolutely right.
Okay, my question then is, under his recommendation, would we also, we would put all students who participate in indoor sports and other higher risk activities should continue to wear masks and keep physical distance as much as possible. Schools may consider using screening testing for student athletes and adults, such as coaches, teachers, advisors, who are not fully vaccinated. Then do you want to include, with the exception of those that are one, unvaccinated persons who have had laboratory confirmed PCR tests? That needs to come out or stay in? Because I don't know how you would.
I think the third sentence of the original document is the one that I have the issue with. If that third sentence can be replaced with the first sentence in the bullet that I provided, I think that would cover my concerns.
Okay.
I'm not sure what the rest of the board thinks, but this is the third sentence that I would like the first sentence of what I wrote to be replaced that third sentence.
Okay.
Yeah, I agree.
Okay, so that third sentence would be replaced with the all students who participate in indoor sports and other higher risk activities should continue to wear masks and keep physical distance as much as possible. Schools may consider using screening tests for student athletes and adults. That part's fine because it goes on in the document with that. So
yeah.
what you're wanting to put in is that first sentence, correct?
Correct. Replace the third sentence of the original document with the first sentence of this.
Okay. Okay.
Knowing then as at a later date when students become fully vaccinated, at some point we can revisit that as well, right?
Yes, correct. That is correct. We would continue to revisit and offer guidance whenever there is a change. Okay, the next one is page 13, playgrounds and physically active play. Okay. Please consider replacing the final sentence of the first paragraph with the following. Okay, you're wanting to replace it when physically active play, physical education activities, and recess are held indoors. All people, regardless of vaccination status, should wear masks and minimize distance when possible.
Yes.
I would agree with that.
Yes, I would too.
Okay. And then please consider replacing the first sentence of the second paragraph with the following. Preventing COVID-19 for all that participate in these activities remains important.
Yes, I just added this. The Clay County Public Health Department is to protect all, and I wanted this document to reflect that.
That's a good, I agree.
So replacing that first sentence of the second paragraph with instead of preventing COVID-19 for those who are not fully vaccinated in these activities remains important, we would put preventing COVID-19 for all that participate in these activities remains important.
I'm good with that.
Okay. All right. Then consider changing the first sentence of the third paragraph. It starts with the ECE providers to the following. ECE providers who are planning structured physically active play should also consider risks for all people participating and attending. And it currently reads ECE providers who are planning structured physically active play should also consider risks for people who are not fully vaccinated. So this again would just include everyone. Are you okay with that, or do you want to leave it?
I'm okay with it.
Yes.
Kathy, you had a couple of suggestions for the high intensity play.
Yeah, I think that those are answered in the, well, first of all, let me just say with this sentence, ECE providers, if we make it congruent with what's already in the document, I'm not sure about attending people, having those last two words, for risk for all people participating and attending. I'm not sure that we have people attending in, when we do recess or physically active activity outdoors. But I'm okay with the wording. Either way, if attending needs to be in there or not, I'm just trying to figure out the kind of what that event might look like. So we're talking about playgrounds.
Yeah, most of your events that would involve in the past year canceled.
Yeah, well, that's true.
So, you really haven't had public attending.
Yeah.
But
Well,
you're okay with it.
Yeah, I'm fine with it. Yes,
Okay.
I'm fine with this.
Was this the section you wanted the high intensity activities in?
I don't think so. I think it was the prior, it was the prior section, but I believe, I don't know. I don't know if that's a consideration. Let me just read it. It just considers exertional activity. So it just says masks should, and this is a CDC directly from their website as well, their guidance. Masks should always be used in public settings, but if you are unable to wear a mask because of difficulty breathing during high intensity activities, choose a location with greater ventilation and air exchange, for instance, outdoors versus indoors, and where you can keep at least 6 feet of distance from others during the activity. If such a location is not available, opt for low intensity activities such as walking or yoga that would allow for mask wearing. I'm not really sure. I read that again. I think we are covered here, as far as guiding the schools along by using the terminology when possible, and that's already in the document when we talk about physical activity and mask wearing. I believe when possible would cover the segment that I just read, and so I don't think we need that. I just think that school guidance it's helpful to just consider exertional activity, because there are times when you just can't, it's very, very difficult to wear a mask in high exertional activity. And it's just, so giving schools the term when possible gives them that leeway to be able to discern that with their events.
Okay.
So good.
All right, the next recommendation then is on page 16. Again, it's a table, table 2, which is screening, testing recommendations. Dr. Gates, you were recommending that in the high-risk sports and activity section and the second column of low and intermediate risk sports and activities, high risk and low risk, okay, that we consider, or who have one unvaccinated persons who have been laboratory confirmed PCR test COVID-19 illness within the prior 3 months and fully recovered. And then your second section there was the unvaccinated person who tested antibody positive. And we kind of,
right. Again, this is a similar situation, particularly with on that bullet point, the number 2 we've talked about. From what I'm hearing, it's not something that we want to go forward with. The first one, I think that's consistent with part of the, with what we've done earlier in the document, but correct me if I'm wrong. The number 1 there, or who are the number 1.
Right. Unvaccinated persons who have had laboratory confirmed PCR test COVID-19 illness within the prior 3 months and fully recovered. And you wanted that under high risk sports activity and the second column of low and intermediate risk sports and activities.
Yes.
So you were looking to put that in the, where it says recommend screening testing for high risk sports and extracurricular activities at least once per week for participants who are not fully vaccinated. You want to replace that, or you want to add that?
I think I wanted to add it to all of those columns in that row of high-risk sports and activities. There's like a blue, yellow, orange, and red column.
Right.
So all of those columns, I would ask that number 1 be put in those. But if that doesn't fit, then it's a little bit different. But that's what I have. It's just adding that 1 sentence.
So I do think that puts us back to that whole debate of, is an antibody test equivalent to vaccination? And our feedback to the board.
No, I'm not talking about the antibody. This isn't about the antibody. This is about if they tested positive within the past 3 months, like for the PCR test, not antibody.
Okay, so if they've had an active, or they've had a documented infection in the last 3 months.
Yes.
Okay, and that's what you were talking about earlier, wasn't it, Kathy?
Yes.
Okay.
Yes. Yeah, and that's already in the table. We're putting it in the table there, but to have it under this section too is, the redundancy is not terrible to have. So it's just a repeat we are putting in the table from the prior highlight. So on that first highlight. So yeah, I'm good with that. I agree.
Okay. All right, and then page 21 or 22, section excluding identified close or direct contacts.
Yeah, this was the antibody situation.
Antibody.
Yeah, we've, at this point until, this is the guidance that same paragraph is from the CDC. It's unfortunate that we have a little bit of conflicting information, but ultimately it is going to be difficult to have these are not low risk situations in the school because there are kids with high risk or teachers or other people they might come in contact with, and it's about operationalizing it. So I get that, and so I'm okay that this not be.
Okay, so you're removing this. Okay. All right, Kathy, did you have another area you wanted to make a suggestion for?
No, I don't.
Okay.
No. Nope. I think we covered everything with Dr. Gates's questions and great suggestions.
Courtney, anything from you?
Just that the language is written as recommended throughout. I believe that we had spoken about removing the mandates when the cases were lower in the spring. And is that right?
Yes.
That was kind of where we were at. And now we see that Children's Mercy is almost full and our cases are going up. And this is without even having the students in school yet. And I just feel like I would be remiss if I didn't, do whatever I could and what I felt like I could to protect as many children as possible. And so I would be in support of a mandate for masks. I know that these are just guidelines and that they're not mandates that are being given, but our school districts are looking at what it is that we're going to be passing along to them as guidelines to make their decision. And a lot of them are expecting that we will pass some kind of a mask requirement so that then they can just say, okay, the county has asked us to do this. So anyway, that's my say on it.
Okay.
And I feel comfortable with all of what, we've gone through as far as changes go. So,
okay.
Thanks.
Well, this particular document that we're looking at is a guideline. We haven't gone to that step of mandating anything. We are providing guidance to the schools. They are then the ones who make the decisions about whether to go with what we're saying, okay, this is the best practice. And so whether they accept that or whether they deviate from it. But as Kathy said earlier, it's nice to have some wiggle room for them because there are some kids that, cannot wear a mask all day long. And so they have to have some ability to be able to work with that. But in general, we are giving them the suggestion and the guidance that they do keep all of their children in masks with this document. Are there any other considerations for change to the document?
I know the clarity is helpful. I guess to add on to Courtney, just, I don't know if the word strongly could be inserted or not, or what you all feel, the board feels about that. Strongly recommend, if that would help, just the intent of our wording. I don't know. I'm just throwing it out there. Don't know how that would, the opinion there with that.
Well, it's up to us to decide what goes in the document.
I guess I don't
go ahead.
Sorry, I guess I just don't understand why we were able to mandate before, and now we are not doing that. Like, we're just presenting guidelines and recommendations. I just feel like with our elementary students having no form of protection whatsoever, then, you know, we're opening it up for them to easily be able to get this virus. So I'm just confused as to why we could do the mandating before, but we can't now.
When the pandemic was really high, we had the opportunity to be able to mandate that for county-wide. Now, since then, there has been some legislation that limits what we can mandate and the period of time that we mandate. This document doesn't have an actual date on it that says this is good for, you know, now through September, because it's a continuously working document. It's something that we will every month have a discussion on about, you know, is there new data? Has something changed? Should we make adjustments to it? Should we make new guidelines, new recommendations? If we put it out as a mandate, then it's good for 30 days. And so that doesn't really help the schools for the school year. You know, we need to be able to give them something that they can work with for a period of time until we have more information, more data, or, you know, recommendations from infectious disease people about, okay, we need to change something. We need to make a difference. Does that help?
It does. I appreciate you explaining it. You know, I'll vote for this because I feel it's important we give guidelines to the schools, but I also am very concerned about our elementary age students.
Gary, anything to add to that? Is he frozen again? I think he is.
Nope.
Oh, okay. Okay, if there's no other suggestions or recommendations, I would entertain a motion for action on this school guidance document. Someone wants to make a motion.
So moved.
Kathy, make the motion? You want to make the motion to accept the?
Oh, I'm sorry. Yes, I would motion that we accept the school guidance document with the edits as we've discussed and made effective immediately.
Okay.
I could second that.
All right. Any other discussion?
I would like to add a discussion point, if I may. You know, just for the good of this group and our audience, public health departments are charged with protecting the community from communicable disease, infectious disease. That includes containment. And that's not for some, but for all. In other words, that's for the greater good, and that's what I feel this document is doing, is we, our public health departments are charged with that. That is a number one priority. And so that is, I appreciate that, this guidance and giving schools the ability to have that. We've heard from a lot of people with an overwhelming, over the last few weeks and months, with an overwhelming call for that protection, overwhelming call for protection, an overwhelming call to uphold the charge of public health to protect the community from communicable disease. I'm preaching to the choir with those of you that are employed with Clay County Public Health Center, because you, with your expertise in epidemiology, master's and doctoral level in public health, you know that all too well. I would say that none of us wants to be in this pandemic. None of us are wanting to wear masks. None of us want to isolate. No one is wanting to do this. But for the protection of our community and for public health, we carry on, and for the greater good of our society, we carry on this, and it's a worthy calling. The guidelines and the school guidance written within, they've been so well written. I appreciate all the work that's gone into that by the experts that you have employed there at the Clay County Public Health Center. The 45 citations that were in this document are outstanding and reliable. The document's been fully vetted by many outstanding local sources who are on the front lines in our communities. That includes Liberty Hospital's ID infectious disease physician, who's also the chief medical officer of Liberty Hospital, the North Kansas City infectious disease experts, Children's Mercy infectious disease experts, pediatric physicians from our area, multiple local pediatricians and pediatricians at Children's Mercy. Tri-County Mental Health has vetted this document. Also, the following resources were used: the American Academy of Pediatrics, the CDC, the Missouri Department of Health and Senior Services, and the Department of Elementary and Secondary Education. This nationally accredited health department, Clay County Public Health Center, has many experts that I've referenced, and I have been privileged and honored to get to work with these folks for the last 15 years. During the pandemic or not, I get to see an inside look in working with them. They are an outstanding group of honorable and full of integrity folks that we are working with here. I've served on this board. This is my 9th year. We've gone through the accreditation process together. We're going through it again, nationally accredited. That's a high honor for a health department to achieve. And so I just say that all for the good of all those hearing, that we don't take this lightly. We're obviously not paid. We are elected, but you can trust, I hope you can trust our decisions and our guidance, and just appreciate the call for protection, protecting the community, and the #1 role in public health. And my deepest sincerity and congratulations to Gary Zabarak, who carries on this mission for, 40+ years in public health. That type of expertise we're honored to have in our community. So thanks to all of you. And that's all I had for discussion.
Thank you, Kathy. Very well said. Anybody else? Any other discussion? Okay, I have a motion and a second. All those in favor?
Aye.
Aye.
Aye. Opposed? Same sign. All right. We have accepted our COVID-19 and on-site learning guide for schools and early child care centers with the corrections and additions that we have approved tonight. And that has passed. It is 8:11. I don't have any other business, so need a motion to.
I'll make a motion, we adjourn.
Good.
Second.
All right, all those in favor?
Aye.
Opposed? All right, thank you very much. I know that you all have worked very hard on this and have put a lot of thought into it. So thank you very much. I appreciate it. And I appreciate all the discussion tonight. Gary, can you stay on for a minute?
Actually, I can't.
Oh, okay. Well, call me.
Okay.
Thank you, Pat, for your
all
leadership.
Right. See you guys next week.
Thank you, everyone.
Bye.
Thank you.
Thank you all.
Bye.
Bye.